Today we're going to be doing range of motion exercises. So I have my bath blanket, and I've performed my beginning 5, and I've explained to Liz that we're going to do range of motion. Now before I can even begin doing range of motion, I have to verify with the care plan which exercises I'm going to be doing, and also how many times I'm going to be performing each exercise. So I'm going to first, before I do anything else, I'm going to offer my patient if she has to use the toilet. You need to use the restroom? Okay. So I'm going to cover my patient up with the bath blanket. And then I'm going to raise the bed to a comfortable working height. Now, the care plan for Liz says that I should do each exercise 3 times. So I'm also going to be very careful that if Liz ever complains of pain, I'm going to stop immediately and report that to the charge nurse. Or if there's any redness or swelling in the joint, or if ever the joint doesn't have full range of motion, I'm going to make sure that I report that as well to the charge nurse. So I'm going to start with her head. I'm going to remove her pillow. And I'm going to make sure I keep my hand behind her head, and I'm going to put my other hand here on her chin, and I'm going to do flexion and extension and flexion and extension and flexion and extension, and I'm also going to rotate to the right, rotate left. Remember, these are slow movements. Rotate right, rotate left, rotate right, rotate left, and I'm going to put the pillow back underneath her head. I'm going to move down her body, keeping the rest of her body covered up. I'm going to come down to her shoulder. I'm going to make sure I support her hand and her arm, so I'm not just flopping her around. I'm going to make sure that I go in slow motions here. It's a stretch. It's a gentle stretch and exercise. We're going to do flexion and extension and flexion and extension and flexion and extension. We're also going to do adduction and abduction, adduction and abduction, adduction and abduction. We're going to do horizontal adduction and horizontal abduction, horizontal adduction, horizontal adduction, horizontal adduction, horizontal abduction. And then we're going to hold her arm at a 90-degree angle, and we're going to do external rotation and internal rotation, and external rotation and internal rotation. Again, I'm going to keep my hand here under her elbow so that I'm not grinding her elbow into the sheets, shearing her skin. Okay? I'm going to come down and work her elbow now. There are 2 exercises for her elbow, starting out with flexion and extension, and flexion and extension, and flexion and extension. And then I'm going to turn her hand and do supination and pronation and supination and pronation and supination and pronation. And I'm going to move down to her wrist, and I'm going to do flexion and extension, and flexion and extension, flexion and extension. Going to her fingers, I'm going to do flexion and extension, flexion and extension, flexion and extension. I'm going to do opposition, where you're moving your thumb to meet the fingers. Opposition. Opposition. Then I'm going to do adduction and abduction with her fingers. I'm going to separate her fingers out. Abduction and adduction. Make sure that I'm checking the whole time for any redness or soreness, any reddened areas. And I'm going to replace this area, cover her up so she's nice and warm. Are you doing okay, Liz? Okay. And I'm only going to expose the side of her body I'm going to be working with. I'm going to come down to her leg. And I'm going to support her entire leg, one hand here down by her ankle and the other hand at the back of her leg. And I'm going to do flexion and extension, flexion and extension, flexion and extension. The whole time I'm going to be feeling with this hand underneath her thigh to make sure that her hamstring doesn't get too tight. I'm also going to be doing abduction and adduction, abduction and adduction, abduction and adduction. And then if this is in her care plan, I'm also going to do internal rotation and external rotation, internal rotation and external rotation, internal rotation and external rotation. Keeping in mind that I never would want to do internal rotation on a patient who had had a previous hip fracture. I am going to move down to her knee and do flexion and extension and flexion and extension and flexion and extension. Coming down to her ankle, again making sure not to rub her heel on the bottom of the bed. Flexion and extension, flexion and extension, flexion and extension. I'm going to come down to her toes. I'm going to bend her toes and stretch them out with flexion and extension, flexion and extension, flexion and extension, and again with abduction and adduction, moving the toes apart. And if I see any abnormalities at this point, I would make sure to report that to my charge nurse. I'm going to recover my patient, and then I would repeat all of this on the other side. So then I'm going to lower my bed. And put the side rails back down. Position my patient for comfort. Remove the bath blanket. And perform my ending 5.